The theme is really about understanding what's happening within management in healthcare, given the context of changes and policy initiatives that have affected healthcare organisation and the organisation of care in the last few years, and which is likely to continue to influence management practice within the forthcoming period. We are focusing as a group of researchers upon looking at what happens to management skills, management knowledge and management practice. So we're drilling down, if you like, from the more macro organisational changes that are affecting healthcare organisations into what's happening to managers at the level of their practice and also their professional identity as managers. Now clearly there's been an awful lot of changes within healthcare affecting management and the numbers employed and engaged within management structures, and we're part of what we look at has been investigating the consequences for management, including increased workloads, restructuring and the implications that has for management jobs and roles and responsibilities, and the stresses and strains placed upon managers within a healthcare environment. We're also interested in managing knowledge and flows of learning within the healthcare sector, particularly as it relates to management, and what changes within healthcare mean for how managers engage with other managers in terms of sharing knowledge and learning, or the barriers that arise in terms of them sharing knowledge and learning across trusts, across parts of the healthcare system. So our managers' networking opportunities and the threats to those opportunities are an important part of what we're interested in looking at as well. There are a whole series of governance issues associated with how healthcare trusts are organised and managed and governed from the board level, that particularly in the wake of things like the Mid-Staffordshire problems and the Francis inquiry that stem from that, have led to questions about how boards operate and how they might help relieve and solve many of the problems of that nature that might arise within healthcare organisations. And of course there's a number of workforce issues to do with the ways in which change has been implemented or will be implemented within healthcare organisations. So for example, what part do human resource management staff and departments play? How do they mediate changes occurring within health organisations? What role do unions play when it comes to workforce engagement and involvement? And how are generally changes within healthcare embedded and sustained in order to improve healthcare delivery and organisational performance? So there's a whole series of issues there to do with the management of and management within healthcare organisations, which in the context of change we think is very important for understanding the prospects for healthcare performance within the future.